I'm Yasin Chaudhary. I'm an IAS officer, 2015 batch. I'm currently MD NHM, Jammu and Kashmir. I'm sure that a week ago you would have followed this very important development in the health sector in J&K. That was the release of the SRS survey results. The SRS is the sample registration survey, which is conducted by a third party, a government mandated third party agency, to look into our leading health indicators. And I'm very, very proud to say that Jammu and Kashmir has dropped its IMR by a solid 3 points. It has come down to 17 points from 20 points, and this is the largest increase ever in the history of Jammu and Kashmir, and in fact, the largest increase between two successive readings in the whole country ever. So this goes on to show that all these major developments that we have made in terms of in addition to our healthcare infrastructure, particularly maternal and pediatric infrastructure, has yielded results, and we are securing the lives of our neonates and infants. Now, before I go on about this, let me tell you a bit about what we have been planning. So on 6th June, Jammu and Kashmir is going to host the first of its kind MCH Conclave, or Maternal and Child Health Conclave, which is basically a 2-day national level event which will be in the format of a best practice sharing summit. So we want to lead the country in bringing together all the leading maternal and pediatric experts, both from the tertiary care side, the clinical side, as well as the community health side, and also from the Ministry of Health and Family Welfare, as well as developmental organizations, multilateral organizations like WHO, Norway India Partnership Initiative, so on and so forth, and have an intense series of discussions, a series of panel discussions on the burning topics related to MCH here in J&K. So this was being planned well in advance for pretty much the last 6 months. But because and this IMR reduction news just happened to come, so we are very glad to leverage upon it and make J&K as the center of attention, or rather as a center of convergence for discussions regarding improvement in MCH care. Now, I'd like to lay some background. National Health Mission, its genesis was actually in this scheme called RCH, Reproductive and Child Health. The dozen other schemes were added later, but maternal and child health remain our core bread and butter, so as to say. The Janni Shishu Suraksha Yojana, Janni Suraksha Yojana, or the Rashtriya Bal Swasthya Karyakram. These have been, the age-old, schemes that have been running in NHM for the last more than a decade. And we have been building upon them, not just in a beneficiary-oriented scheme promotion manner, but also, as I said, in terms of infrastructure. And this is where I'm coming to. So, one instance or evidence that I want to lay out is the establishment of dedicated infant and neonatal care, or rather critical care units in the form of, say, SNCU, Special Newborn Care Units, or NICU, NICU, Newborn Intensive Care Unit, or PICU, Pediatric Intensive Care Unit, which NHM had been very arduously sponsoring and establishing in all the district hospitals, and even those which later got converted into GMC, and even the CHCs. And it is because of this infrastructure addition that we had been able to see, more and more sick neonates not being referred, and hence, losing their lives in transit, and many other things. We are very proud to say that J&K UT, or NHM J&K, was one of the first state or UT state health societies in the country to establish all these units in a time-bound manner. I am also very glad to inform you, and a lot of you would have followed this particular event which took place in SMGS Hospital, Jammu, a couple of months ago. This was in regard to the ECRP package, the Emergency COVID Response Package, which was given by the Government of India, the Ministry of Health and Family Welfare, as a special dispensation to states and UTs to fight COVID through various means, be it, say, infrastructure support, HR support, drugs and diagnostics and whatnot. And as a part of it, particularly as a part of ECRP2 package, we got sanction for 42 maternal ICUs and pediatric ICUs. And the foundation stone of the same was laid by Honorable Lieutenant Governor Sir 2 months ago in SMGS. And I'm very proud to announce that all of those ICUs have been completed. They have been successfully constructed and are functioning, and will be inaugurated during the inaugural session, during the opening session of this MCH conclave in the morning of 6 June. These ICUs are all 20-bedded ICUs, and they are established in all the district hospitals. So the whole idea of specialized ICUs. I mean, normal ICU every district hospital has some way or the other. But specialized ICUs for maternal and pediatric care were not existing, and this is the single biggest infrastructure addition in this subsector for the last decade, I would say. And now we can, imagine or rather expect that our critical neonates would get, intensive care treatment in Kupwara alone, in Kulgam alone, in Kishtwar or Punch, and would not have to be referred endlessly. A few other developments that I wish to add upon here. So this event was basically planned in collaboration with the Norway-India Partnership Initiative, which is a unique, collaboration running between Government of India and Government of Norway. And in India, 3 states, run this program, or were chosen to run this program, and these include Rajasthan, Chhattisgarh, and Jammu and Kashmir. NIPI has been associated with J&K for the last 7 years now, and their support has been critical in terms of, it has been very essential in terms of, consultancy and monitoring and evaluation studies, which lead to course correction and proper implementation of our programs. TFR in J&K is only 1.4. That's one of the lowest in the country. That means our population is diminishing. I'm not sure if you have noticed, but almost every road in Srinagar today has a signboard of a IVF clinic. There are new ones grooming everywhere. We recently also realized that there's also been a subsequent rise in miscarriages. And that's possibly happening because of the drop in fertility, rise in IVF treatment, IVF in conceptions, and more miscarriages. We are falling into a cesspool, death trap of more, diminishing, fertility, and that's why we must ensure that whatever we have with us, existing maternal and child health efforts are strengthened, so that no mother who's delivering a baby or no infant or no fetus who's coming into this world dies in vain, dies without help or support. That's all from my side. Thank you. We cannot say that, and neither can we guarantee it, because it's a phenomena. It's based on the personal choice of those parents who are undergoing their delivery, and also the medical practitioner who's advising them. See, we don't want to say that cesareans are bad. We're not saying that. We're just saying that they should be avoided where they can be avoided. And natural birth must be promoted. We are entering into a fact, so there's also this argument that cesareans are safer, that a woman is much more likely to die during natural birth. No, that's a myth. The percentage possibilities, probabilities on both cases are actually similar, pretty much. So we want to do away with this, fad which is growing amongst women in Kashmir, that nahi cesarean nahi karana hai. Also, it's become a lifestyle phobia, because women think no, there'll be too much pain, and they don't want to experience it and stuff like that. So we want to promote a conscious decision making, which is made by a well-informed and aware parent and an ethical doctor, so that we can bring down the rates. So it is a collaborative effort. Just the schemes alone or regulatory mechanisms alone are not going to push it. Okay, so it's a myth that Kashmir healthcare systems are one of the best in the country. I mean, we are proud to say that it is good, but there are so many areas where we need to work upon. Now, अब आप यही देखिए, हमारे cesareans क्यों बढ़ गए हैं? Because there's been too many nursing homes who are giving out cesarean services. Okay. जस्ट बिकॉज ज़्यादा नर्सिंग होम्स खुल गए हैं, इसका मतलब कि हेल्थ केयर सर्विसेज अच्छी हो गई हैं, वो मायने नहीं रखता. हम इस प्रोग्राम, दिस इज बेसिकली अ बेस्ट प्रैक्टिस शेयरिंग समिट. So we want to, aware more people. We are bringing in a lot of MBBS students, PG students to come and listen to our technical sessions, so that our health department ecosystem, they get pushed to reorient themselves towards these goals, to further decreasing IMR, to further decreasing MMR, to further promoting natural births. So it's all to basically kickstart these practices. While also we are inaugurating, as I said, 42 ICUs, maternal and pediatric ICUs. As I began my briefing, the IMR has decreased, so very, very substantially by 3 points. So we are looking at the lowest death figures, infant death figures ever in history. So that is to say, it is actually a good situation, a nicer situation for us. But specifically for the LSCS audit, as I said, there's no rule. So, for instance, like PCP and DT, as in gender determination, we have a regulatory penalizing tool there, but we don't have any such thing in cesarean. We can't hang a surgeon for conducting an LSCS. A woman who, even though can deliver a normal child, but is adamant that she wants a cesarean, she cannot be denied also. So that is to say, we have to work in a promotive manner rather than in a coercive one, is what I mean. But I will be adding that it is, of course, when we review it, then of course we, at least within our government setup, our government doctors, we can ask and pull them up कि हाँ भाई क्यों इतने ज़्यादा आपके सिजरेंस हो रहे हैं, नेचुरल डिलीवरीज क्यों नहीं हो रही. एक और चीज़ मैं आपको बता दूं जिस पे हम ज़्यादा जोर रख रहे हैं, दैट इज मैटरनल डेथ सर्वेलेंस रिस्पांस सिस्टम, or MDSR. That's one of the new, sophisticated mechanisms that has been instituted to the ministry, and so there's something called MDR, which is a very textbook practice to be done in all hospitals, maternal death review. That if any woman dies in labor, the whole hospital staff comes together, sits in a hall, and discusses why she dies.